Well, I hope this pathophysiology class has been a good time for y'all. I know there's a huge amount of information, and in your final posts on the week 9 discussion board, you have commented nicely about your favorite systems and what you like. And I was noticing the nervous system seemed to be a system that really intrigued a lot of you. The cardiac system, of course. The immune system, which is unusual, although I think the immune system is phenomenal. All of the systems are so phenomenal, and what's more phenomenal is how each of them integrate and work together. So also there was a couple good comments for me about making some more videos, so I wanted to leave you with just one aspect of a musculoskeletal system, and that is just looking at some cervical fractures. I want to just talk about, first of all, I'll leave you with what's known as an odontoid fracture, and this is a fracture at C2 level. And 80% of these are flexion injuries, about 20% are extension injuries. Neurologic injury of the spinal cord is usually less than about 15%. There's a type 1 which requires C-collar for 6 to 8 weeks. A type 2, which is non-displaced, and a less than 5 millimeter displace of the cervical of the odontoid. Treatment usually with a halo brace, 8 to 12 weeks. If it's displaced greater than 5 millimeters, the treatment could require a surgical fusion of C1 and C2. And a type 3 break, it requires a halo for approximately 12 weeks. Then you have what's called a Jefferson fracture, is the C1 fracture. This, by definition, is a 4-part fracture. It's a rare injury, rare neuro injury, and the treatment is a halo brace, about 8 to 12 weeks. It includes one of 4 presentation. One could be a posterior arch fracture of the spine, a burst fracture, a comminuted lateral mass fracture, or an anterior arch fracture. An isolated posterior arch extension or anterior arch flexion fracture is rare as well and requires C-collar. Then Hangman's fracture is a fracture of the C2 and can include structures like the pars interarticularis and some other traumatic injuries to the spondylolisthesis, which is an injury. Type 1 and type 2. Type 2 is a greater than 3 millimeter angulation, which is a displaced vertebra. And it requires traction, reduction and with traction. And then there's what's called a type 3 fracture. It's usually going to require an open reduction, internal fixation. And these really are degrees of displacement from the normal alignment of the spine. There are some others are compression and flexion injuries of C4, 5, and C5, 6. And that's the common place for them to happen at those levels. You have stages 1 and 2. Usually the posterior longitudinal ligament is intact, and they wear a rigid collar rather than a halo. Stage 3 is diagnosed through MRI to evaluate the posterior longitudinal ligament, and if this is disrupted, there could be some kyphotic deformity likely. It requires a posterior cervical fusion. If the PLL is intact, then a halo. And then your stage 4s and 5s have much more common neuro injuries. And then the vertical compression, this is the most common at C6, C7, and sometimes C5, C6. There's stages 1 and 2, which have a rare neuro injury, and Usually the posterior longitudinal ligament is intact, requires a 6 to 8 weeks of a collar, maybe a halo, maybe not. And a stage 3 is a burst fracture. Sometimes requires what's known as a corpectomy and bone graft, and there's usually neurodeficits associated with this, and could require posterior stabilization depending on what's shown on the MRI. And then finally, there's some injuries called distraction, flexion injuries at the C5, C6, or C6, C7. And then, of course, you have stage 1 through stage 4, which really are percentage-wise more serious subluxations. Stage 1 is a less than 25% faucet subluxation. Stage 2, then 25 to 50% unilateral facet injury. Stage 3 is greater than 50% bilateral facet with a step off of the spine. And stage 4 is full body displacement, which requires a halo, and then there's usually a high amount of late instability of the spine. And usually this treatment also has a surgical closed or a non-surgical closed reduction and halo, and sometimes a surgical posterior spinal fusion. Again, these are the bony structures that have been fractured, and the extent of neuroinjury is assessed on obviously through physical assessment. So that just gives you a little bit of a take on some cervical injuries that occur as with trauma.